I'm Dr. David Hill, and today we're going to talk about how to treat cold sores on the outside of the mouth. Now, the first thing we need to talk about is what is a cold sore and what causes it. Classically, a cold sore is really an infection with one of several human herpes viruses. There are quite a few strains of the human herpes virus, and many of them are capable of causing a sore on the outside of the mouth. Now, when I say herpes, people tend to get really upset. They say, oh my gosh, that's a sexually transmitted disease. Well, some forms of herpes are. However, just because you have a cold sore on your mouth does not mean that you've gotten sexually acquired herpes. Chances are you got it the way most of us get it, from casual contact with other human beings. That sore will probably start as a bump. It may turn into a blister, and then that blister will usually erode and form sort of a shallow, very painful pit. Usually there's sort of a burning, stinging, or tingling sensation where that thing is. Usually there's just one, although sometimes there's more. Now, if you get a whole bunch of them, especially if they're at the top of the mouth, they're covered with a yellow crust, you need to be thinking about something different called impetigo. Impetigo is an infection with a bacteria, usually strep or staph, and that's not going to respond to herpes medications. If you have any doubt, you may want your doctor to get a look at the lesion or even take a culture of the lesion to figure out what sort of organism is causing it. Now, if we know this is herpes, the medications that work best are taken by mouth, and they're available by prescription only. The oldest is acyclovir. The brand name is Zovirax. A newer, similar medication is called valacyclovir or Valtrex. Both of these need to be used in the first 48 hours of the cold sore. After that, it's useless. The viral replication has gone too far. You're just going to have to ride it out. If you get recurrent cold sores, your doctor may prescribe you medication that you can have on hand to take as soon as you get the first sign of the sore. Now, over the counter, you'll see that there's a topical Zovirax that you can put on the lesion. Unfortunately, in patients who have intact immune systems, this does not seem to work particularly well. It may make you feel like you're doing something, but chances are it's not going to do very much for the cold sore. It may actually be more effective in patients whose immune systems are compromised, people with HIV, cancer, or some sort of immune deficit. However, in the immune-competent patient, you probably don't need to waste your money on the over-the-counter stuff. It doesn't do very much. So talking about how to treat a cold sore on the outside of the mouth, I'm Dr. David Hill.